I just watched Discovery Health Channel's Medical Mysteries, and it was the one that covered Ehlers-Danlos Syndrome. So naturally I watched. And the woman that they covered had a lot of information. They covered that everyone thought she was a klutz, and they covered that she dropped things, that she felt a lot of weird pain, that doctors told her to just splint it and move on. So she definitely went through all the motions of having EDS undiagnosed. When she finally got her diagnosis and they started explaining it, I think they went through it rather quickly, and their focus was on surgery rather than splinting and pain management, which is the general prognosis. Surgery is an option, but I feel like you need to clear a couple of things up. First of all, the woman had had over 40 surgeries to stabilize her joints. It's rather impractical to stabilize a joint every time a joint goes loose with EDS. I wanted to read part of a study that I saw. It's called Ehlers-Danlos Syndrome in Athletes, and it's written by Eric Schroeder and Mark LaValle. It's probably the most useful work I've found so far. But they do mention surgery in here with citations. It's an excellent article if you can look it up. It's written in 2007, so it's recent. When conservative measures have failed to provide symptomatic relief, surgical intervention can be considered. 47% of participants in a recent study had previous orthopedic surgery, and these procedures were more common in hypermobile type, 57%, compared to the vascular type, 17%. Another survey of 44 members of the Ehlers-Danlos National Foundation evaluated 214 procedures performed on a total of 95 joints, most commonly the knee and shoulder. Stability and pain relief were the primary indications for surgery, and satisfaction rates were 67% and 59% respectively. Only 6% of procedures were performed to restore a range of motion, and the success and satisfaction rates for those were 100% and 92% respectively. Management of traumatic unidirectional shoulder instability in these patients deserves special mention. After failed conservative management, the results of Bankart procedures in general population typically produce 98% good to excellent results with recurrent instability in less than 10%. Sounds promising. The failure rate of operative procedures to restore shoulder stability was reported to be 53% in a survey of EDS patients, likely a consequence of their inherent soft tissue elasticity. So you're looking at overall in shoulder and knee stabilization surgery about a 67% success rate. So you're somewhere between 98% and 59%. To me that's not particularly promising. That's a huge variation. So the idea that they would say that she should go under all of these continuous surgeries suggests that the rest of us should too, and I think that's misinformation. They didn't mention improving muscle tone, which Howard Levy, who's at Johns Hopkins, does suggest in his evaluation from genetest.org of Ehlers-Danlos Syndrome hypermobility type is the name of his article, and he focuses on muscle tone rather than on muscle strength, and does not advocate surgery. So that's just something I had to clear up. That if you're going to consider surgery and you have Ehlers-Danlos Syndrome, do your homework. Talk to other people and get out there and find information, because there's so much changing every day and so much to learn. And if you are having surgery, keep an eye on it, chronicle it, share it with the rest of the community, because you may be part of that change where we find that there are successes, and that can give hope to everybody. So the Bankart procedure that Schroeder and LaValle mentioned seems to have some good successes. So if you're having that, let us know. If not, keep up the good work. There's lots of ways to deal with having a genetic condition. But when you're approaching 40 surgeries, you may want to consider some alternatives. And also, when you're having recurrent surgery on the same limb, you know, that's definitely a red flag, especially if you have the vascular type of Ehlers-Danlos syndrome, because you may be more prone to complications from surgery that are going to cause more dangerous and lasting effects than the surgery itself, and probably not as positively. So, you know, do your homework. Disclaimer, of course, I'm not a doctor, check with yours, but definitely do your homework before you consider surgery. I think I've made it pretty clear. Okay, take care.